I'm pleasure to introduce Monsenso and Thomas Lethenborg, CEO. We'll try and go through that case on what that can make of an impact on society. So Thomas, you can take it from here.
Thank you, and thanks for the invite, and thanks for everybody attending. My name is Thomas Lethenborg. As Michael said, I am the CEO of Monsenso. Joined Monsenso 6 years back when we started the commercial journey, and have been driving that business since then. I'll start with a quick overview of Monsenso, then dig into our mission, vision, and how that links to the impact that we're making, and the fact that Monsenso is an impact investment. I'll talk a bit about the solution so that you get an overview of that, as well as our go-to-market model and our business model, and then wrap up at the end. If we look at Monsenso first, we are a validated software as a service-based digital mental health solution. So basically, as you see on the right side here, a patient app for self-monitoring and for getting help between consultations, as well as a clinical web portal used by clinicians, psychologists, psychiatrists, coaches, as well as researchers to understand how patients are doing in their real life between consultations, to basically transform a reactive treatment paradigm to a more active treatment paradigm. Why mental health? Because it's a growing market. It's a globally unsolved problem. It hasn't become less important during COVID-19, as Michael mentioned. We've done 8 years of clinical and technological research and development. The solution is CE marked as a medical device. We're ISO 13485 and 27001 certified. Which is very important, especially in 2021, because medical device regulation comes into effect, and hence it will also be MDR certified during this year, and basically thereby having a license to sell into the public sector in Europe. We've done business both with pharma as well as public, private healthcare providers and research institutions. We have an experienced team, leadership and board of directors, and we were listed actually exactly 1 year ago on June 10th last year on NASDAQ First North. So if we look at our mission, it is really to help the ecosystem provide better mental health to more people at lower costs by providing this solution that fits into the life of both the patients, family caregivers, as well as also clinicians and researchers. And our vision is to become a leading provider for mobile health, digital mental health, based on a commercial foundation. We come out of research, and we've been living a lot from research grants in the past, and we are transforming that into becoming a pure commercial company. Scalability and simplicity in everything we do is important, and want to have partners in all our major markets. And we want to use the data that we collect as part of our solution to really get a data-driven intelligence into both diagnosis, prevention, and treatment to allow for this paradigm shift that I talked about. And in the middle of this is really the impact and the sustainable development goals that we're talking about. And if I try to comment on how we address those, I would just start by having the patient in mind. It's patients like this bipolar patient that we're talking about, who get a greater insight, who are becoming engaged, who are empowered to live a more stable and high quality life by using our solution. That's what we're talking about. So Monsenso is an impact investment. We're addressing, first of all, of course, the item number 3 here, or on good health and well-being. And I just want to talk about 1 or 2 case stories within each of these areas. And in good health and well-being, if I use the example of Region 8, the capital region of Denmark, who is implementing this for all of their bipolar patients, it's really about enabling the patients to live a higher quality life, to help them or try to prevent that they are actually being readmitted, that they are coming into hospital again, that they have a relapse, and help them live a decent life and also have the economic growth, which builds into item 8 here, or goal number 8. The other kind of solution that we're doing in this space is with municipalities or social care. If we take a customer like Ikast Brande Kommune, they're using our solution to support their addiction treatment. And basically what that means is that while they're in addiction treatment, the health providers or the clinicians they can follow the patients who suffer from addictions or the citizens who suffer from addiction. And also after they've been discharged from that program, they can still follow the people and reach out to them proactively and help them not getting back into a addiction condition again. So it's really about keeping people on track, liaising with people, connecting with them, and creating a more efficient way of conducting the services, which reduces the healthcare system's budgets as well as increasing the quality of life of individuals. When it comes to decent work and economic growth, obviously what I just talked about from these two use cases is spilling into goal number 8. But there's also some very concrete projects that we're working on that is directly addressing goal number 8. We're working with Impano as a private provider, as an example, with Slagelse Kommune municipality, to basically follow people with mental issues to help them get back and support them in getting back to work and stay at work. So this has a tremendous effect on the society, because mental illness is a primary contributor to loss of productivity across any of the disorder categories that we're talking about. I'll come back to that. When it comes to innovation and as goal number 9, we are widely involved in a lot of different innovative projects. We come out of a research project, a European-funded research project. We continue to be involved in research, and we actually invested more than 5 million kroner into the platform's development last year. When it comes to reducing inequalities, as Michael shortly pointed out, mental health is also about inequality. There's a lot of talk about equality in health, and people living with mental illness or who are burdened with mental illness, they are likely to receive less care than those who don't have that. It's just and this basically just is a tool to engage them, connect them, make sure that they get the right care at the right time, so that they're helped in the right way. When it comes to sustainable cities and communities, we're also involved in projects, also in green projects. We just listened to Donkey Republic, and we're actually part of a research project that connects mental health and green routes, so very much in their space. It's called Go Green Routes, one of the Horizon 2020 projects that we're involved in, where we're measuring the effect on mental well-being by choosing green alternatives in cities. And we're also encouraging the choice of green alternatives as part of that project. So that's quite interesting. And when it comes to partnership for the goals, we're partnering both with research institutions, but also with private providers and pharmaceuticals in trying to create interventions for people with mental illness that is innovative and that help them increase their quality of life in general. So I think that with that said, it's pretty clear that an investment in Monsenso is also an investment in impact. I've already talked about the left side here, which is the mental health. The important thing is that 28% of all incapacity or inability to work is coming from mental illness. And that's a big point. If we can address that, and when we help address that, it really pays off. So an investment in this area pays off both in the healthcare budgets as well as in the social care budgets. On the right side, we have the global mobile health market development, which is expected to grow by 40% over the next years. The solution, I've already briefly talked about it, patient app in the middle, which is partly for remote monitoring, but it's also for treatment support, so give patients help between consultations. We share that via the secure cloud-based platform, software as a service platform, with the clinicians on the right side, so that they can follow the results, outcome, behavior, and personalize the treatment based on data. And we can also connect family caregivers, social workers via an app so that they're better informed about the progress of the patient and better equipped to conduct the right care. So it's an easy to use, personalized clinical solution aimed at remotely monitoring and collecting real-world data on the one side and also supporting the treatment on the other side, so that patients increase their quality of life and make the most out of their treatment, so that clinicians personalize the treatment for better results and optimal impact. For clinics and hospitals, so the payers basically, to deliver better treatment to more people at lower costs. And for partners, private providers as well as pharmaceuticals, to collect real-world data to document the efficacy of the intervention that they provide, whether that's a drug or whether that's a service provided by a service provider. These are some of the case stories. I don't want to dig into them because we've already talked about a number of them related to the impact picture that we had here, but clearly we are based on research, but we're now having the majority of our business coming from commercial engagements. A few quotes from some of our partners at Watkins. With at Watkins and University of Exeter, we have a prevention of mental health project going into in trial, both in UK, Germany, Spain, and Belgium, where we're trying to help young people build their emotional competence to prevent development of mental illness, something that is particularly relevant now in the aftermath of COVID-19. Another quote here is from Lars Kessing, who says that there is a strong opportunity to prioritize the right help to the right partners at the right time and avoid relapse and improve quality of life with patients when you use Monsenso. We've worked with the Capital Region of Denmark since the inception of Monsenso, both on the clinical side as well as on the research side of things. The highlights from 2020 is that we created 76% revenue growth, 78% growth in our commercial revenue, which is the transition from research to commercial that I talked about. 76% of our revenue generated outside Denmark. We were at that point 19 employees, so we also created a lot of sustainable, good, decent jobs in Denmark because that's actually a doubling from the listing that we did in June. We are active now in 12 countries. We created a subsidiary in the UK, and we obviously had a successful IPO a year ago. The outlook is also midterm, 70% revenue growth. We do see some impact, among others, from COVID-19 that is impacting our revenue growth this year and delaying some of the decisions, but we'll still have around 50% revenue growth this year. And we are aiming for 70 million revenue in 2024. Our go-to-market model is really selling with partners. So we're back to the partnership thing that we talked about across Europe, the big 5 European countries, as well as Denmark. And then having a direct touch on regions, municipalities, primarily in Denmark and UK. We will, with our strategic partners, also have, and with partners in general, have a business outside of Europe, and we already have that. You may have seen the deal that we did in the Arabic countries with a global pharmaceutical back in December timeframe, January timeframe. That's an example where we move with a partner into a new territory, and that's very interesting for us. And our partner focus is where our solution really support the partner's core product, whether that's a medication or whether that's a service that they provide to the general public. Our business model is a B2B business model, or B2G, if you will, for when we sell to local authorities as well as healthcare regions, and it's based really on a set of consultancy services and then a subscription per user, per month, or per year. Depending on the market and the setting that we're in. And obviously, consulting services are also depending on the complexity of customization that we do, because it is a configurable solution that we're selling to the market. Our team, now 22 people across 6 nationalities, and all highly educated. And we also have an experienced leadership and board in place. We made some additions to the board that we think are very beneficial over the last couple of months as well, that will help us take the company to the next level. Just want to finalize then with another quote from a patient, because this is also a way to eliminate the stigma and get these patients to actually say how they're feeling. It may be difficult sometimes, and it does represent a better picture of the overall situation of the patient when they're actually registering how they're doing on a daily basis and sharing that with their clinician. So, in summary, I think most of the points I addressed initially as well. Software as a service-based digital health solution in a growing market, an unsolved problem with a great impact, based on research, a certified solution and company, and with an experienced team behind it who has scratched the surface in a relatively big market with some interesting partners and customers. That's really what I wanted to say. I hope I didn't get too much over time, Michael, but happy to receive questions. And if somebody want to join our journey, I mean, by all means, sign up to our newsletters or our social media communication.
Perfect. I have one question. I think we know that the mental health is you don't respond to first treatment, second treatment, sometimes not third treatment. Is that the big selling point, and where you have the large savings when you talk to insurers that this can be a disability going from the first treatment not working until your third? Is that kind of your big selling point, and where you actually are saving a lot of the money for society?
It's a very good point. So there is awareness and there is interest is exactly in that area, both from insurers as well as from pharmaceuticals also, who then have treatment-resistant depression drugs. So medication that is really only classified to be used when you have, without effect, taken a couple of medications before, right? So it's a way to identify patients who are not responding to treatment and give them something different. And that's both from a medication point of view as well as from a therapy point of view. And it's crazy the way our system works across all of the countries that we're talking about. We have 2-year programs. We give people with schizophrenia, with borderline personality disorder today, we enroll them in 2-year programs without really stopping and saying, does this work? And stringently measuring the impact of a 2-year program. And sometimes there may be a possibility after 6 months to say, no, this was a misdiagnosis based on the data that we have. Or say, this patient actually needs to go into a different treatment because we already see the effect of the current treatment. So there's no point in continuing for another 18 months. Did that answer your question?
Yeah, I think so. And lastly, it's been harder to do deal making, but I also think remotely looking after chronic diseases has gotten a new way of thinking. It's a possibility. So are you seeing it as a hinder in 2020 and start 21? But you are seeing the market growing in the future because of COVID-19.
I probably didn't mention that we have a positive view on the future because COVID-19 has forced an otherwise pretty reluctant technology population. Psychiatry in general, psychologists, psychiatrists have not been that used to using technology as part of their work. It was largely a talking discipline, right? Where you had conversations with patients. So they needed to get used to using technology in general practice. COVID-19 has clearly pushed and paved the way for solutions like this, where we otherwise saw some reluctance among the clinicians. So that's
perfect. Yeah, but I think we catched it, Thomas. So thank you for taking us through the presentation and looking at a little different side of the impact investing. but it's really, really big out there. A lot of impact companies are in this telehealth and this space. So very interesting to hear your story, Thomas. Thank you.
Thank you. And thanks for everybody who's listening. Have a great day.